Hello, testing. Hello, testing. Good morning. Today is Saturday, September 25th, 2021. Our regular Saturday yoga therapy class. Thank you for joining. Today's topic, another important topic, yoga therapy. It is holistic, not reductionist. So what does it mean? First of all, as you all know, yoga as a therapy, we talk about, it is the philosophy of yoga, it is the practice of yoga, 8 limbs of yoga, and just 1 second. I just need to see something. Something is not working here. Technical problems. Okay. Okay, I'm back. Sorry, we all go through these technical glitches. So again, today is the Saturday, September 25th, 2021. This is our regular yoga therapy class. Today's topic is yoga therapy. It's a holistic, not reductionist. Let's first off see what does it mean, then I'll show you the practices. As you all know, yoga as a therapy means it's a philosophy of yoga. It is a practice, 8 limbs of yoga. It is a daily routine called dinacharya. It is our lifestyle, we call it Jivan Darshan. It's a lifestyle medicine. And it is a holistic, that means whole. Holistic doesn't mean holy, doesn't mean that it is yes, it is a spiritual practice, no question about it. But here, holistic means somebody forget to put the W in front of holistic. So I generally write holistic with a W, with a parenthesis, which covers the whole. On the contrary, our Western medicine is a very much reductionist. We are specialized. I'm a cardiologist, I'm a pulmonary, I'm a kidney specialist. My diagnostic is geared towards a different organ. We treat one-to-one. It's like you're playing a tennis match. It's like playing your tennis match one-to-one is a Western medicine, which is reductionist. On the other hand, yoga therapy you can consider is like a football game. It could be football, could be soccer, whatever term we use, you have 10 players, 11 players, you put all of their brain together, one brain is better than two brain, and you do a therapy for the whole body, mind, and spirit. Even the father of our modern medicine, Hippocrates said, I am not interested about the disease the person has. I'm interested about the person who has the disease. Very, very important concept. I'm interested about the person. So we are interested about your holistic person. So people will come and ask me, what should I do for diabetes? What should I do for hypertension? What should I do for arthritis? What should I do for breast cancer? I said, yes, you can do this, 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 this. But you need to prepare your body and mind to have a yoga therapy practice. And I'm going to show you the practice which you need to prepare for a holistic practice. In that context, yoga therapy is very much connected to Ayurvedic philosophy. If you understand what Ayurvedic philosophy is, Ayu is the longevity, Veda is the knowledge. It's a knowledge which gives us the longevity. Ayurveda is a philosophy. It looks at our call a body, mind, your composition or body, mind, your psychophysical body type, called Vata, Pitta, and Kapha. Person who is a Vata, generally they're ectomorphic, they're catabolic, they get more neuropsychiatric and musculoskeletal disorders. General statement, but exception is always there. Pitta is a mesomorphic, it's metabolic. They have the primary inflammatory disease, disease of the liver, small intestine, heart, and we have yoga practicing to balance the pitta imbalances. Kapha, on the other hand, is your endomorphic looking, very rounded, heavy. It's anabolic in energy. Primary disease is your cellular multiplication, like you're a tumor, or it's a fluid-related disorders. So we understand the psychophysical body type and arrange accordingly. So let's take a look first. What is a holistic practice? As you know, yoga therapy is a relaxation response. Yoga therapy is a activation of parasympathetic tone. So when you get the activation of this parasympathetic tone and you have the relaxation response, you have a counteraction of your lifestyle related conditions. In a yoga therapy, primary component is to start where you are. It is not competitive. Remember, it is not competitive. Very important concept. So it is not competitive. You start where you are. you are not mastering the asanas. You are using the asanas in stages for therapeutic benefit. Remember, you start where you are. You do not compete with anybody. You don't master the poses or asanas. You use the asanas in stages for its therapeutic benefit. You start the asana without any pain. If you are sitting in a posture, even if you're sitting here, you get a pain, you back off. Find a place where you don't have any pain. If you create any imbalance in the physical body, it will show up in your breath. Your breath will have an effort in breathing. So you have to have an effortless breathing. What does the effortless breathing means? Say, I am practicing a spinal twist, Bastrika. Okay, I'm going to give you an example so you understand how to start an yoga therapy practice. Here I am. My body is in this is called your Dandasana. Spine is straight, hands on the side. I first do a relaxation of my toes. When you separate your toes, breathe in, breathe out. I practice every single day so I can share with you. Breathe in, breathe out. A little bit of ankle relaxation. Breathe in, breathe out. I'm breathing out first. I'm breathing in and breathing out longer than my breathing out is longer than breathing in. If I have a 2-second in, I have a 4-second out. Breathe in, breathe out. Breathe in, breathe out. Now let me show you practically what I'm talking about on effortless breath. I'm doing a spinal twist, Bastrika. Putting my feet here. Slowly I'm pushing my right knee to the left side. My left hand comes outside my right knee. My right hand goes to the back. My hand touching the knee. I'm still talking. I'm still singing. I'm totally effortless in my breath. Now I breathe out first. Take a deep breath in slowly. Now I'm going to turn my body towards my right side. I'm still talking. I'm still breathing fine. I give a little bit more twist. I can feel I'm having some effort in my breathing. I cannot take a complete deep breath. So what I do, I back off. I find a place where I can do my breathing out longer than breathing in, and I can stay in the pose without any pain for at least 5 to 10 breaths. This will initiate the phenomena which is called your neuroplasticity. When a neuroplasticity sets in, you'll be seeing slowly and slowly, you'll be doing more and more. A primary relaxation response for the whole body, very interesting, is that reverse prayer pose, Paschim Namaskar. What happens in a prayer pose to the back, you think you are relaxing your upper part of the body, but it also relaxes your thoracic spine. Relaxation extends down to your lumbar spine, to your hips, knees, throughout the whole body. So as you have all seen, I've shown it to you before, that you can sit down, you can do it in a chair, you can do it anywhere. You can do it in a chair, you can do it in your, I'm sorry, you do it in a chair, you can do sitting down, you are in totally effortless. So how to do it? You have seen it, maybe doing it before. You sit down, you can sit down in a easy pose, Sukhasana, Siddhasana, Padmasana, Lotus Pose. Put your hands together slowly here. Close your eyes. Do your breathing out longer than breathing in. Slowly you can turn around your hand. And if you stay in the pose without any pain and with effortless breathing, you will feel a sense of relaxation in your whole body and mind. Relaxation will help you to breathe properly. You breathe out first. Take a deep breath in, breathing out longer than breathing in. If you stay a little longer, you see your hand will go high up again. Stay here a little longer. Pay attention to your breath. Breathing out longer than breathing in. Your eyes are closed. You will be bringing a profound level of relaxation. The answer to this is that when you have a lifestyle-related chronic diseases like diabetes, hypertension, heart disease, arthritis, you name it, neurodegenerative disorders, if you can start doing this very simple relaxation technique, you will see the effect of it immediately. Remember, we have our experience, our research showed that every yoga, asanas, every pranayama, every meditation, this is time-tested, practice-based evidence. I have so many people that come to my class, they stay with my class, they go home, they say, oh, my blood sugar has gone down. My blood pressure has gone down. In fact, we do all the yoga practice now with our health tracker. We use an Apple Watch or use a Fitbit. So I'm talking to you, I'm effortless, and I'm having saliva in my mouth. Saliva in my mouth is a parasympathetic activation. Just to show it to you, I can go a little bit more higher up. I had a lot of problem. I had a right shoulder dislocation. I had a serious pain in the right shoulder, but I kept on doing this thing in stages, short of pain with effortless breathing, holding it for a little longer and longer time. Neuroplasticity sets in. I can do it very effortlessly now. reversed prayer pose to the back. And I have shown it to you in multiple times. You can incorporate your neck relaxation. You can do your bumblebee breathing. You can do all of your practices with prayer pose to the back. Next one is a wonderful pose, is a squatting pose called Mulasana. We all do it. I get up in the morning, first sit down. Oh, before that, I want all of you to show you this yoga mat. Few people ask me about this yoga mat, where you got it from. If you can see this yoga mat, very interesting yoga mat. I'm in my daughter's home in Maryland. My daughter is an attorney and then certified yoga teacher. This is her personal mat, and this mat has been painted and designed by my wife, Shikha, who is a professional artist, and this is her painting on a mat. So this is a custom design mat, and I'm so lucky that she gave it to me for me to practice and to use it for my class. So now we know the story of this. So Mulasana, as I said, get up in the morning, we sit down in a squatting pose, hands get relaxed. When you put the fingers separated, when your fingers are all separated, hands are pretty much relaxed. Relax your wrist with extension. Put your one elbow inside, other elbow inside, and slowly bring it close to you. Now, I hear it all the time. I'm trying, I cannot do it. This is your ultimate asana pose. And you are not going to compete, and you're not going to get into the asana pose. You will be starting where you are. Where you are, if you cannot come down, hold onto something, hold into a chair, hold into a wall, come down, maybe you can come down here or here. Stay here. Stay here, eyes closed, effortless breathing, then you come down here. Eyes closed, effortless breathing, eventually come down, because we are also like a stick. We couldn't do anything. But now, with relaxation, I can do everything. So, when you get into this relaxation response, this becomes a holistic practice. I got a question. Oh, you do so beautifully effortless Peacock pose, Mulasana. I need to have a hand strength. You don't need to have a hand strength. You keep practicing a whole body asana practice, you will see your strength will come back on its own. So, for example, let's show it to you. What is your Peacock pose, Mulasana? And I have to differ with you, this is a hand strength. It is not a hand strength. It is a total body balance, the total body-mind coordination. So here I am, putting my hands here. I'm going step by step. If you put your hand on your elbows, push your body in front, your whole body is going to go high up. I'm talking, I'm breathing. I was effortless. So, question to you is, was it my hand strength? Yes, maybe. No, I don't know. But I can tell you this is your whole holistic practice. If you look at anatomically, if you look at physiologically, your whole body, mind was working together. Holistic practice, not reductionist. Wonderful holistic practice is a thunderbolt, Vajrasana. Everybody, in our age group, I tell you one thing, people have a knee pain and a hip pain. Our knee joint and hip joint, they transmit our body weight. So when they get transmission has an issue, then you get into all the knee problem and hip problem. Having some issues today, maybe with the internet. Anyway, you guys are seeing me. That's good enough. I see a lot of issue here. Okay. In our age group, every time I say your wonderful holistic practice is a thunderbolt, oh, I cannot do it with my knee pain. No, I had the knee pain. I have a swollen knee. Remember, I have arthritis. Oh, my joint is gone. My cartilage is gone. It's a bone-to-bone rubbing. Cartilage doesn't have any pain fiber. It's when there is a inflammation, when damage to the cartilage, our body does a splinting. It wants to splint for the joint, so the ligament and muscle gets tightens up. And all the pain fibers are in the ligament and the muscles. So if you go in stages, say, I am practicing my Vajrasana. So I have my ankle here. I can sit down very much. See, people who practices, say, faith-based practices, they will do a lot of practices, different posture. One of them is this asanas, and they do very well. So next you do slowly. So if you can put your feet down and able to sit down on your feet. I cannot sit down on my feet. That's okay. What you do, you get a roll of. I like a roll of. I won't say a blanket, but like a towel, wrap it. In fact, many a time you can do this thing too. You can just roll your. This is a wonderful way to start. Take a look at what I'm doing. I'm rolling an yoga mat, and on this roller here, I put my ankle here, and I'm sitting down. Within a short time, you get a wonderful relaxation. I cannot bring my hip down. You don't have to. Go ahead, get a small pillow, put a pillow in between. I show it all the time. Have a pillow, maybe put 2 pillows or 3 pillows, but find a place where you are comfortable, without any pain, and with your breathing completely effortless, breathing out longer than breathing in. This posture in Thunderbolt keeps your spine straight, supports your head and neck, and it relaxes your whole body and mind to the point that it activates a profound parasympathetic tone. As you all know, parasympathetic is the calm and digest. It is a wonderful practice to do after a big meal. Remember, we do all the practices in an empty stomach. This is one asana we say you can practice in a full stomach. See how beautiful asana it is. When you can sit down in a Vajrasana Thunderbolt, think about diabetes. Diabetes, your blood sugar is high up. But what is the blood sugar high up? Blood sugar is high up because body cannot digest your sugar. This asana will activate your digestive fire, Jathar Agni. Also, your whole gastrointestinal tract, from the mouth up to your anal canal, supplied by parasympathetic nerve. So what happens when you get a proper parasympathetic activation, you get a saliva in your mouth. I cannot demonstrate to you as clearly, but I can tell you, take my words, I am having a profound, relaxed breathing technique. I can breathe out completely effortlessly. I can take a deep breath in completely effortlessly. I can breathe out completely effortlessly. As you say simply, this will literally melt your body. Wonderful experience for your diabetes. Again, parasympathetic activation is a therapy for your cardiovascular disorder. People with atrial fibrillation, as I sit down in Vajrasana. If you want to progress a little bit more, you can do Gomukhasana. Put your one hand in the stomach, the belly button. Remember one thing, everybody asking me, when do I breathe in? When do I breathe out? When do I breathe whole? Yes, there is always, before a muscle works, you breathe in because you get some oxygen for muscle working. When the muscle is working, you breathe out. But most important component for yoga as a therapy, every asana you will be able to do it with completely effortless breathing. You'll be talking, you'll be singing. So here I am. I'm slowly looking straight high up. I'm coming down. So here I'm coming down. What I'm looking for? Pain. Here I get pain. So what I do? I back off. I stay in a posture where I don't have any pain. I completely doing my breathing. Breathing out longer than breathing in. So in a short time, this thing will happen. And in a short time, this thing will happen. Slowly I'll come down. I will have my head down into the ground and I'll be staying there again. With my breathing, I may be even singing, I may be even talking to all of you. The biggest compliment I ever got from a world famous yoga teacher, and the compliment was, you have been talking, you have been breathing, you've been totally effortless every asana you do. She even clearly mentioned you are doing a peacock pose, Mayurasana, you are doing a headstand, Shishasana, and you are still talking and breathing effortlessly. Love this thing. This is your holistic practice. Here you are. See, steps of holistic practice. Sukhasana. Put your feet under your knees, cross it in the middle, keep your spine straight, eyes closed, touch your index finger and thumb, put it over your knees, breathing out first. Take a deep breath in, breathe out longer than breathing in. Practice. If you're practicing with me, keep on practicing. As I always say, people ask me, are you preparing yourself? Are you doing any preparation for the class? I said, no. I don't need any preparation. You ask me to do a class, I will do it right now. Why? I don't teach. What I do, I share my daily experiences. I share my daily practices, share my knowledge. So, I'm comfortable now. Then I first change my foot. The moment I turn around, what happens? My opposite side of the brain is active. Now I'm practicing a balancing holistic practice. Next step, Siddhasana, perfect pose. Take my heel all the way to the back. Take my one foot in the top. My other knee just drops down. Make no effort. For you, gonna do it. I have a knee pain, I have a hip pain. Yes, my right knee is swollen. My right knee, if you can see, it's almost 1.5 times more swollen than my left knee. I've seen an orthopedic surgeon, he's shown everything. Oh, I don't see, there is some tear, there is something. Okay, I can take care of your pain. I can put a little cortisone injection in your knee. That's fine. He's my friend. I said, you don't need a cortisone. I have a yoga therapy cortisone for me, which is called Sukhasana, Siddhasana, Padmasana. Easy pose, perfect pose, or a Lotus Pose. So, go back again. Opposite side. Now, here, causing pain. So what do? Back off. Find a place where there are any pain. See, adjustment. There is no adjustment in yoga therapy. If you adjust it, what will happen? It will come back high up again. The way it will go down, close your eyes, do your breathing out longer than breathing in, and slowly this thing will happen. It's a basic high school chemistry. It is called your aerobic glycolysis. Glucose with oxygen will have an aerobic glycolysis. It will convert into carbon dioxide, water, and ATP, called adenosine triphosphate. ATP is an energy. More you can remove all the carbon dioxide from your lung, and you can bring more oxygen in, you will have a more aerobic glycolysis, and you will wash away the product of anaerobic glycolysis. Anaerobic glycolysis means when the oxygen level is low, glucose combines with low oxygen and forms lactic acid, pyruvic acid, pain-producing substances. It's a disaster for a human being. Okay, you've seen both sides. I use a Sukhasana, easy pose, and a Siddhasana, your perfect pose. Now comes your Ardha Padmasana or a Swastika Asana, half lotus. Again, it's hurting here. What do? Back off. But I continue my other components of the yoga asana, therapeutic yoga asana. What it is? Eyes closed, spine straight, effortless breathing, breathing out longer than breathing in. Still hurting. Go put somewhere. I am not going to do it because it's hurting me. Fine. Don't do it. Go home, take some pills, and prepare yourself or start digging your own grave. The moment you say, yes, I'm going to give a little try, maybe a little discomfort. We call it a comfortable discomfort. And this will happen to you. You can separate your toes, put your finger in between your toes on both the sides. It will start relaxing. In fact, I sit down like this, and for yoga therapy practices, I will do a little rapid Bastrika Pranayama. I will do a rapid Bastrika Pranayama in this, which will bring more relaxation, more holistic practice. Let me show it to you one time so you'll understand. Remember, Pranayama is completely effortless practice. You start as slow as possible with effortless breathing. For us, we have been doing it for so long, we can do as fast as we can do as rapid as we can, but we are still effortless. So don't come and ask me, oh, this teacher told me to do it very slowly. Yeah, do it very slowly, but listen to your body's signal. And listen to my body's signal and take a look what I'm going to do now. And if you want to do with me, it would be great. Rapid Bastrika Pranayama. I did 300. I'm still talking, I'm breathing, I'm totally effortless. Easily I can do 500, 600, which I do for a daily practice. But I can feel the heat in my body. I'm generating. I can feel my whole lung is empty. I can breathe out. Maybe 3, 4 times more than we're breathing in. Normal breathing. Always start with the breathing out in yoga practice. Take a deep breath in. And breathe out. One thing for you to notice is that even it looked like a very rapid exercise. Remember, exercise is a muscle contraction. Exercise is sympathetic. Exercise, your heart rate goes high up, blood pressure goes high up, respiratory rate goes high up. Here, even if I do the rapid Bastrika, I still having some saliva in my mouth. That means I'm having a parasympathetic activation. So these are the things, the points you need to take home. It's a holistic practice. You can combine all of them together. And slowly it enters into meditative practice. Now, I forgot to show it to you. So what I do in the meantime, I do the opposite side. I can do even a rapid Bastrika with the hands high up. Just to give an example. I did 50 of them. Easily to 200, 250. And that is the effect. What is the effect now? I'm having saliva in my mouth. I've been talking to you for about an hour. Did not drink anything, no water, nothing. My mouth is still wet. Take my other foot, high up. I'm in a profound relaxation response with holistic practice instead of reductionist. It is not that I have to have a more strength on my knees, more strength on my hip, more relaxation on my hip, more relaxation on my knees to be in a lotus pose, in a Padmasana. I am in the lotus pose because my body, mind is connected, body, mind in balance. I feel a profound level of relaxation to the point that I feel and a sense of lightness in my body and mind. I check my breath. every time I do a asana practice, which is holistic, which relaxes both the upper and lower part of my body, which relaxes my whole body and mind, my breathing becomes effortless, and I enter a state of meditation. Just be show it to the Mulasana. Right. Put my hands on the sides. Breathe out first. Take a deep breath in. I push myself. My whole body goes high up and stays high up. Mulasana. Here I am. And I can stay here for a long period of time. Close my eyes to my breathing. And it comes in stages and steps. Wonderful asana is a Vaisasana, buffalo pose, which ends up with your Gomukhasana or a cow face. And you will see the whole body gets relaxed. So, if you can do a Vaisasana, you bend your one knee, take your other knee in the top, put it there, and this is also the beginning of cow face because it's called Gomukhasana. Metaphorically, if you look here, it looks like a face of a cow. Same way, I'll sit down, put my fingers in through my toes. This brings me more relaxation. Keep my spine straight, eyes closed. Profound level of relaxation is setting in. Left knee is up, left hand goes high up. Right hand goes to the back. I put my right hand, okay, let me show you from the opposite side so you'll be able to see it. I love this yoga mat. This is a custom designed yoga mat by my wife for my daughter. And I'm privileged for her to let me use it. So, coming back, what was it? My left knee was on the top of my right knee. Left hand is high up, right hand is in the middle. Generally, I put my right hand in the center, middle, take the left hand down. I'm hooking it, closing it, slowly and slowly. I can even handshake each other. When I'm here, now we can see my whole upper body is relaxed, lower body is relaxed. I'm talking, I'm breathing, I'm in a profound level of relaxation. This is your Gomukhasana, cow face. Now we'll see, I'll do the opposite side. And most of you, when you start doing it, you'll see your one side is easier than the other side. Now, I'm changing my foot. My right knee is in the top of my left knee. The right hand goes high up. Left hand is here. I just push the left hand in the middle. Put your hands down, say hook it, and essentially I will be handshaking each other. When you will be able to do both sides equally, both sides of your brain is working, and yoga therapy is the art of balance. When you balance both sides of the brain, this is free, illness free. A whole holistic practice. Be comfortable in any posture. What is called Sthiram Sukham Asanam. Stillness, happiness in a pose. If you are able to sit down in a Mulasana or a squatting pose and able to get up without a support, it will be a pure holistic practice. So, if you see me now, total holistic practice. Sit down in a Mulasana and get up without a support. You will be able to do whole thing from the ground high up. And let me show you that practice. We are comfortable standing like this. People always say, you stand, your feet is. Yoga said, to balance your both sides of the brain, put your feet together. Put your feet together, and this is called Dandasana, or a lot of names. Mountain pose, upward mountain pose. But here, the most important thing that your ear, your shoulder, your hip, and the ankle in the same line. So if you want to test yourself, let me see if you can see me here, or maybe able to see me here. I'm against a wall. Putting my ankle on the back. I have my shoulder in the back, head in the back. My whole body is touching the wall. I am totally, I can take all the way hands high up and stay here with my eyes closed, breathing out longer than breathing in. Another way I do, I put my hand on my head. This is very good for your shoulder also. Put take your elbows, touch elbows on the wall, and keep an eye, the back of your head, back of your shoulder, your hips, and back of your ankle. All are in the same line. Cannot have any better practice than that. You want to be disease-free, it has to come from within you. I am the cause and I am the cure. Bring the balance back. Cross your feet. Cross your feet. See if you can sit down, crossing your feet all the way down and get up without a support. The title of the talk today, yoga therapy is holistic, not reductionist. You're not doing it for knee joint, you're not doing for your hip joint, you're doing for your whole body and mind. And I'm not interested about the disease you have. I'm interested about the person who has the disease. Crossing opposite side. Sitting down, crossing opposite side. Getting up, crossing opposite side. Cannot do it. Support it. Support. Hold on to something. Hold on to something. Hold on to something. Doing holding halfway, getting high up. Eventually you'll be able to do it. If you're practicing with me, do this one. This will be our sort of last practice to show it to you, because this is a purely a holistic practice. And we have all the studies done, clinical research, that this definitely is better than any kind of cardiovascular parameters you have. I'll show you two things and you'll be amazed what the two things does. First, cross your feet and able to sit down on the ground. You are all the way to the ground. The feet are crossed. From here, you will get up without a support. From all the way down to the ground, get up without a support. Cross your leg to the opposite side. Now my feet are crossed to the opposite side. Very comfortable sitting down in the ground. Says, oh my God, how do I get up? Very simple. You try to get up, easily you can get up. When you incorporate a Bastrika Pranayama with your asana practice, that gives you a total holistic practice of yoga. As I always showed it to you, suppose you want to do Bastrika, you can do like inhale and exhale. You can easily do it as long as you want the total holistic practice. Let me end with you a practice which will totally transform your body and mind, improve your cardiovascular function, improve your respiratory function, improve every function in your body and mind. Hands together in a prayer pose. You breathe out first. Take a deep breath in. And when you breathe out, you go down to squatting pose. Baitak, Purna Baitak, full sit up. What do you think? I'm still talking. I'm still breathing. I'm still with all of you. So, see, I'm talking, I'm breathing, I am with all of you. That is the as long as you understand that a practice of yoga from the scripture, people always ask me, I want to read a book. I said, it's nice to read a book, but yoga and yoga as a therapy is 99% practice, 1% theory. If you have to read a book from the scripture, Hatha Yoga Pradipika. Hatha Yoga Pradipika. I am going to continue this Saturday morning class, which I've been doing for years and years in person, now virtually, and I'm going to continue, does not matter where I am. Again this week, I'm in Maryland in my daughter's home. Next Saturday, I'm not sure whether I'm going to be. I'm here basically helping our daughter with the birth of her first child. But next Saturday, if I'm back home in Norfolk, I'll do it from Norfolk. But I'm still here, I'll do it from here. Please join next Saturday for another session, and I will make an announcement beforehand what will be the topic. Thank you. I hope you understand what the yoga therapy holistic means in contrast to reductionist. But again, let me finish with another term. By the time we started practicing, what we find out that a reductionist practice also is very effective in yoga therapy. Like say a thunderbolt pose, Vajrasana for diabetes, Mundukasana for diabetes, Kapalbhati Pranayama for diabetes. So we discovered a new term which is called interesting name, reductionist holism or holism reductionist, wherever you want to put, reductionist holism. That means we are still reductionist, but we are still practicing holistic practice, because a Vajrasana thunderbolt looks like a reductionist, like one asana, but it affects your whole body, mind, and it acts like your holistic practice. Thank you again for joining. Please come and join Saturday for another session.